Hi, my name is Mackenzie, and my speech is going to be on vaccinating. It's April 2019. Mayor Bill de Blasio of New York City announces a state of emergency for an ongoing measles outbreak going on within the state due to lack of children being vaccinated. We cannot allow this dangerous disease to make a comeback here in New York City. We have to stop it now. This year alone, measles has now infiltrated 14 states across the United States and has already killed hundreds. This is just one example of the possible future for the United States. There's a growing concern of why people are deciding to not vaccinate. Measles, a disease once thought to be eradicated, now killing innocent children in 2019. As a society, parents, caregivers, teachers, etc., it's our job to protect children. However, many opt out of life-saving medicine. There's now an order that mandates that all unvaccinated children and adults living or working in the New York area must receive vaccinations unless they can prove a medical exception applies. Those who do not comply could be guilty of a misdemeanor violation and incur fines. Measles is just one of the diseases in 2019 making its comeback. A pro. Vaccinating your children and yourself will help yourself from contracting a deadly disease, but also prevent it from spreading around in the general population. Con. Vaccines hurt, but what will hurt more is when you're laying in a hospital bed with an illness that could have been totally preventable. This outbreak is being fueled by a small group of anti-vaxxers in the New York neighborhoods. They have been spreading dangerous misinformation based on fake science. Health Commissioner Orsis Barbat said in a statement, "We stand with the majority of people in this community who have worked hard to protect children and those at risk." We've seen a large increase in the number of people vaccinated in these neighborhoods, but as Passover approaches, we need to do all we can to ensure more people get the vaccines. In doing my research, the most obvious question that comes to mind is, what is the new trend in which parents decide to opt out of vaccinating their children? A variety of factors came into play: religious and certain beliefs, freedom of individualism, misinformation about risk, and overperception of risk. State legislators and health departments now face a difficult challenge: respecting individual rights and freedoms while also safeguarding the public welfare. Nearly all states allow exemptions for religious reasons, and a growing number provide numerous opt-outs as well. However, in a handful of jurisdictions, neither objection is seriously documented or verified. Often, the law requires a parent to do no more than simply check a box indicating she does not wish his or her son to receive immunizations. The problem is exacerbated by financial incentives schools have to encourage students to opt out of vaccinations. The rise in parents opting out has caused the AMA grave concern, with many experts decrying the rise of so-called exemptions of convenience. In some areas, nearly 1 out of 5 children do not have the recommended vaccines. The consequences are serious, not only for those unprotected children, but for the rest of society as well. Herd immunity is threatened as more and more parents free ride off the community's dwindling immunity, and outbreaks of diseases thought to have already been conquered have already occurred. Lawsuits against vaccine manufacturers threaten them with bankruptcy. Costs are being externalized onto the healthcare and legal systems, and vulnerable populations are suffering harm or even death. In the interest of social welfare, state legislators and health departments should consider methods to ensure that exemption processes are carefully tailored to prevent check-the-box opt-outs of convenience while still allowing exemptions for those with earnest and informed convictions or medical reasons. Other reasons include that they're thought to have caused autism, which is false according to research. Scientific studies show that vaccines do not cause autism. The original article that sparked controversy years ago was shown to be fraudulent, and the lead author has lost his medical license. Still then, dozens of large studies of millions of children have found no evidence of a connection. Another is thought to believe that they have mercury. However, vaccines have never contained mercury, a toxic metal that can accumulate in the body and cause brain damage. However, before 2001, some vaccines contained thimerosal, a safe preservative made from mercury. And even then, to prevent confusion, the FDA ordered that it be removed from all childhood vaccines. The flu vaccine is a multi-dose vial that still uses it, although thimerosal-free versions are available. However, vaccines against life-threatening diseases is possibly one of the greatest public health achievements in history. Literally millions of premature deaths have been prevented, and countless more children have been saved from disfiguring illnesses. While vaccines still carry unavoidable risk, the medical and social and economic benefits they confer have led all 50 states to enact compulsory childhood vaccination laws to stop the spread of preventable diseases. According to vaccines.gov, there are 5 main reasons to be vaccinated: Immunizations can save your child's life. Because of advances in medical science, your child can be protected against more diseases than ever before. Some diseases that once injured or killed thousands of children have been eliminated completely, and others are close to extinction, primarily due to the safe and effectiveness of vaccines. Polio is one great example that the vaccines have impacted in the United States. Polio was once America's most feared disease, causing death and paralysis across the United States. But today, thanks to vaccinations, there are no reports of polio in the United States. Vaccination is very safe and effective. Vaccines are only given to children after a long and careful review by scientists, doctors, and healthcare professionals. Vaccines will involve some discomfort and may cause pain and redness and tenderness, but this is minimal compared to the pain and discomfort and trauma of the diseases that these vaccines prevent. The disease prevention benefits of getting vaccines are much greater than the possible side effects for almost all children. Immunizations protect others you care about. Children in the U.S. still get vaccine-preventable diseases. Since 2010, there have been nearly 10 to 50,000 cases of whooping cough each year in the United States, and about 10 to 20 babies, many of which were too young to be fully vaccinated, died each year. While some babies are too young to be protected by vaccinations, others may not be able to receive certain vaccinations due to severe allergies, weakened immune systems from other conditions such as leukemia or other reasons. To help keep them safe, it is important that you and your child are able to get vaccinated. This not only protects your family, but also helps prevent the spread of diseases to your friends and loved ones. Immunizations can save your family time and money. A child with a vaccine-preventable disease can be denied attendance at schools or child care facilities. Some vaccine-preventable diseases can result in prolonged disabilities and take a long financial toll because of lost time at work, medical bills, or long-term disability care. In contrast, getting vaccinated against these diseases is a good investment and usually covered under insurance. The Vaccines for Children program is a federally funded program that provides vaccines at no cost to children from low-income families. Immunizations protect future generations. Vaccines have reduced and, in some cases, eliminated many diseases that killed or severely disabled people for generations. For example, smallpox. It's a vaccination that eradicated that disease worldwide. Your children don't have to get smallpox shots anymore because the disease is no longer around. If we continue vaccinating now and vaccinating completely, parents in the future may be able to trust that some diseases of today will no longer be around to harm their children in the future. Overall, picture this. It's 2019. Diseases that were thought to be eradicated are coming back and making society sick all over again. We will be reliving some of the most dangerous illnesses from our past in today's communities, all because people opt out of vaccinating their children. I believe this is one of the most crucial topics to talk about in society today because it can affect all of us based on someone else's poor choices. Vaccinations are so incredibly important that I agree with Mayor Blasio. If your children aren't being vaccinated, that is the parent's responsibility and they should be held responsible for it. For that parent to be so reckless in endangering the life of their child, endangering other children of possibly getting sick because some children, because of medical reasons, cannot be vaccinated are incredibly selfish. This topic is something I feel very strongly about. It's our government's responsibility to make sure the public is informed on the importance of vaccinations, but with the growing trend, society, our neighbors, doctors, and virtually anyone needs to express the urgency of getting vaccinated to the next generation.